is Guerra. I am I guess, advocate alias is LEG. I'm one of the co-hosts of Blue Dream Radio, the People's Cannabis podcast. If you're into podcasting, please listen. You got time on your hands, listen. You want to be on the train, download it. Blue Dream Radio. We talk a lot about cannabis and the so-called equity that lots of folks are talking about, but not are really about at all. I'm also the deputy director of One Freedom for All, which is a youth-based, or youth-centered nonprofit based in the South Bronx and focuses at the intersection of food justice, environmental justice, and ending the school to prison pipeline. Similar to James here, I'm also a farmer, so we farm hemp, which is a cousin of, it's cannabis, right? They're all cousins, cannabis and marijuana. And so we farm hemp in Connecticut, as well as fruits and vegetables. And I'm also a doula, so I support pregnant people with their lives, right, throughout pregnancy, regardless of the outcome of their pregnancy. So I support folks through abortion, because abortions are also healthcare. How did you get into using cannabis or other kind of plant-based medicines for mental illness, or how else have you seen it work for folks for other illnesses that they may have? Whoever wants to go first.
All right. The way I was introduced to cannabis was a girlfriend. I've had social anxiety since I was like 12 or 13, diagnosed, and depression. And I had a girlfriend, and she knew me for a while. She knew I didn't smoke, I wouldn't smoke. I was an athlete. I was like, hell no, I'm clean. I'm keeping myself clean. I'm gonna go to the major leagues. I'm gonna play baseball, right? And one day we were about to go to a party, and I was like, I just don't want to go. And she was like, why? And I was like, I'm gonna have to be social. Everybody knows me there. I'm gonna be the fucking center of attention. And she was like, here, smoke this. And I was like, yeah. She was like, come on, just smoke a J. And I smoked the J, and I went to the party, and I was like, oh, this is all right. Like, I could actually talk to people, and I'm not worried about what I'm saying. I was like out of my head, and I started smoking a little bit, and it just helped me not be in my head and think of, asking the wrong question, saying the wrong thing, stepping on somebody's shoes. Like all kinds of stuff would go through my head, and it just helps me like decompress and not think about that, not focus on that. And that was my first. That was my first time smoking. After I had grown, I was already growing and all of that, and I was like, I'm not touching this stuff.
Honestly, it took a while to make the connection that I was self-medicating for lifelong anxiety, like you expressed, James. I just took it as a social drug. I would smoke with friends, but when I began my mental health journey on a whole other separate note, and it got to a point where I had to explore taking medication, I really began to examine my use, and I realized, hey, I'm not really smoking socially. I'm smoking to alleviate social anxiety. That hyper self-awareness that can come as a side effect of trauma. And having experienced a lot of that in my life and realizing when were the times I was calm? When I smoked the blunt. And it's really been a wonderful thing to see cannabis be embraced for post-traumatic stress disorder and other anxiety disorders. Like, I had already received my PTSD diagnosis before New York State recognized PTSD as a treatable condition under the medical cannabis program. And a wonderful development since then is that New York State now recognizes any disorder or medical condition which impedes on your daily ability to function. And that's not just PTSD, that's people with anxiety disorders like yourself, that's people with bipolar disorder, borderline personality disorders, and other mental health conditions that could benefit from having access to this plant and all of its positive attributes.
Thanks, Shayna. Yeah, no, and I think this is super important for us as we're having this conversation, right? Like decriminalization brings a whole bunch of conversations around marijuana or around cannabis, right? And the first one I think that we have to all acknowledge is that we're here. We have literally a consumption lounge, 21 and older, right? Like there's a culture shift that's happening. I was raised in a time where folks, if you had to smoke on the low, and you had to do it, and you had to be scared. And now it's not so much there. Now it's the understanding now is that everyone does it, right? There's my partner is a medical patient in Connecticut, and when I wait into the parking lot for him when he's picking up his order, I see all sorts of folks, right? Young, old, rich, poor. I mean, not so much poor, because if to be honest, medical cannabis is a lot, right? It's really expensive, and there's a separate conversation that has to be had around folks saying that, okay, well, if marijuana is legalized inside your state, right, you can get it at a dispensary, the legacy market, the people on the street are not gonna have work anymore. And the reality is that regular folks can't afford stuff in the dispensary. Dispensary marijuana is really expensive, and people on the streets will have work. I'm sorry? Oh, and also there's moldy cannabis inside the dispensaries, but that's a different story. But it's for us to understand that, you know what, folks have been using this for centuries, right? We understand that marijuana, that cannabis, is something that has been used, literally our ancestors used it, native communities have used it for centuries, and now because of the history of cannabis, because of laws that were passed in the 1930s and 40s from super racist people, hey, there's a little friend, our plants here, the research on cannabis was definitely trumped, right? It was in its infancy at that point, and then we couldn't do it anymore. So now we're in a place where now there's lots of research. You see lots of universities, even some here in New York State, who are actually doing whole programs around cannabis. But this is stuff that my panelists here know, right? They've learned it, they figured it out over time, and it's super important. James, I want you to talk a little bit about just kind of, I guess, your own research that you've done around cannabis and cancer, and how does that work?
It's actually not my research. It's the government's research. PubMed, anybody can go look this up. The government's been doing research on cannabis for God knows how long, probably as long as they've known about it. But they have a bunch of articles, published articles on PubMed, and most of my research centered around cannabis and cancer, because that was my experience. But most of the medicine that I'm into is whole plant extraction, a process called full spectrum oil, or RSO, and it's been proven, not in clinical trials, but it's been proven to cure cancer. Like literally, it gets it into remission. People have beat cancer on that and nothing else. So that's what I focus on. I focus on whole flower and full spectrum, because that's the medicine that people it's why it's legalized, regulated. It's why we're here, because it's medicine, and I think that's the best medicine.
Thanks, James. I personally, if you have never tried it before, RSO is the way to go. It's a personal favorite. RSO is the way to go. Not for all, but yeah, take a little bit at a time. Shayna, you spoke a little bit about the connection between PTSD and cannabis usage, and also you've kind of listed out all the different reasons, right? Or the list of diseases to have, or illnesses to have, that gives you a medical card. Can you talk about what that process is? How to get a medical card? What your experience has been, and how if that's impacted you at all professionally?
That's a good way to start, because my experience obtaining a medical card in the state was very haphazard. I had to budget a certain amount of money, because the max I had heard as far as how expensive it could be at obtaining a card, and now keep this in mind, this was 2019, because PTSD was not approved as a qualifying condition until December of 2018, if I recall correctly. So by January 1st, 2019, I was eligible. And I remember budgeting about $500 because it was such a range in cost. Because first you have to have the qualifying condition. That's the way it worked then. And as anybody who has gone through the disability process, you may spend hundreds of thousands of dollars just to get a official diagnosis, which will then give you access to disability and accessibility services. So thankfully, I had already obtained the qualifying condition, but I can guarantee you that had I not had that paperwork ready, it could have cost me way more. So I budgeted about $500 because I saw that it was ranging from like 200 all the way to 500. And I had to go through a series of trials and errors trying to find a doctor because I wasn't, quote unquote, plugged in to where someone could refer me to someone. So I eventually settled with a telemedical service, NUGMD, which had been utilized, I had used previously in California before they went full legal with adult use. And I found out some very disturbing things with NUG. When I went to finish the application for New York State, I did find a clause which stated that female users had to be on birth control. And I kept all the screenshots. I have all of that documentation. So I had to confront NUG on that. And they did remove that clause. But it was, I can see your face right now. It's a very problematic clause from several standpoints in regards to reproductive justice, in regards to the invisibility of our queer, trans, and intersex family. And after some back and forth, they did take it off. And then afterwards, finally, I settled with Presto MD, and I've been doing my renewals with them ever since. I find them to be the most accessible, the most gender neutral, and the most cost efficient at about, I'm gonna say with the tax budget, about $150. But as you can tell, it's been quite a story.
Thank you. Yeah, shout out to Presto. Presto Doctors and Presto MD has been amazing partners to us, but yeah, they definitely do get it. And Presto's literally all over the country. Everywhere there is new decriminalization happening in a specific state, they are there, they're doing the work. But yeah, like when we talk about cannabis, there are so many intersections between cannabis and everything, right? So cannabis and mental health, cannabis and physical health, right? Cannabis and reproductive health, reproductive justice. And the reason for that is because cannabis really intersects with each part of our lives. We are multi-issue people. We're not single-issue people, right? We live very complex lives. Even the folks who are here right now, we're coming from all walks of life, right? Different experiences. And by virtue of that, cannabis is just a medicine, just like anything else. We have our beautiful plant here. I thought what was very interesting to me was that all the plants, the ones that actually go out to bud and flower, are actually female plants, right? And so as we're talking about decriminalization and as we're talking about, dispensaries and people having more access to these plants, it's also thinking that these are still living beings, right? They are female living beings, and so we should treat them with respect and with honor. We're seeing a lot of companies, the brother over there was talking about moldy weed. It's these large capitalist companies who are taking our plants, right, and are really exploiting it the way that they exploit people. And so just for us to just take into consideration that we have to treat the plant well, because just like we're not treating the earth well and the earth is coming back at us, right, like today started off, it was like 50 degrees in the middle of June, and now it's much warmer. It's for us to have that consideration and thought around how do we treat the plant, how do we make sure that these plant-based medicines and the earth that we're in, that we're doing a good job of treating them well. Hold on, I have my little notes here. Okay, so Shayna, I wanted to just talk a little bit, because I think you alluded to it a little bit, just talking about PTSD and kind of, or maybe it's not all intersected that way, but just your experience as someone who was arrested for using that plant and how that's impacted your life?
I can talk about I'll start up with the immediate and then the long term. The immediate was that as a minor, I was denied that one phone call that you're guaranteed as a constitutional right. I was denied my phone call to my mother, which caused both of us great trauma because I am the only child of a single mother. So I'm going to say about 17 hours, my mother had no idea where I was. So that was, as I said, very psychologically traumatic for the both of us. Also, it changed my career path forever because once upon a time I had wanted to be a forensic profiler for the FBI, and back then the rules were even more stringent in regards to who could be hired. And even when my record was sealed after 6 months of good behavior, there was no way that they would ever take me now. And I found that out the hard way when I went and applied for the police rangers. And to be honest, I went and disclosed my arrest because they were going to find it anyway, and I was immediately booted. So I actually had to drop out at John Jay College as a result of that. And I pretty much entered the workforce from that point on, and I did not go back to pursue my educational career until a couple of years later, but that was a completely different track. I mean, as far as the long term, it created, the seeds were already there for lifelong distrust of the NYPD, but after that, because the cops who actually put the cuffs on me, they didn't want to take me in. They saw 2 roaches and it was like, okay, we don't know what to do with this, so we're gonna go to the sergeant. And the sergeant was a stereotypical white buzz cut kind of dude. And they told him, they're like, we found, yeah, she was smoking in public and we found her with the roaches, and like, do we really gotta take her in? And then he said, yeah, she gotta go. So what was the reason for that, other than to quote unquote teach me a lesson as a young woman of color? So the psychological and the legal ramifications lasted for a long time.
James, have you heard anything of any similar stories, similar of folks being impacted? You're laughing because, I'm sure you have many. But stories of folks being impacted by, getting caught by the cops, whether it's here in New York, I know you're down in DC and down south too, but experiences, because I think many folks can identify with a moment.
I don't even want to start talking about police and anything. Besides the fact that they should be, expunging everybody's record that ever got any kind of charge at this point.
Woo! Yes, expunge everyone's records.
Yeah, because the vast majority of my trauma has come from police. Like she just said, if it wasn't from police, at least 3/4 of my trauma I wouldn't have. Just my interactions of having to deal with police, just, the things that, my homeboys will tell me on a regular basis, yo, you're crazy, because I talk to police any kind of way. Right? I say anything, so what, why are you pulling me over? All of that, I'm militant. I want to know what you're doing, why did you single me out, all of that. So my whole life, my homeboys have been like, yo, calm down, well, you want to get shot. And as far as the weed, we already know. A lot of my homeboys still cuff their weed because they still think they're going to get arrested. And I've been telling them for years, so it's legal. And they still be like, oh, police, oh, hold on. Because, people got charges for dime bags, nicks, roaches, right? It's too crazy. It's too crazy the things that have been happening from plants.
They're literally plants, right? So imagine getting arrested for walking around with a tomato plant, or oregano plant that you can get at Whole Foods, right? A little plant of basil, right? You can literally get arrested at that. Still to this day, right? Decriminalization, right, is not legalization. And I was recently in a space where folks were talking about if you work for a government agency, because cannabis is still illegal on a federal level, you wouldn't be able to get a job, right? If they did a drug test and if you tested positive for THC, then you wouldn't be afforded that position, even if you were a medicinal patient. So, it's still a plant, right? And so we still have a long way to go. Certainly we've come far, from where many of us here on the panel started off, but we still have a long way to go. And I think, to the point about like even Shayna and your experience becoming a medicinal patient, I remember like 10 years ago going to the Bay Area and checking the back of a newspaper, and literally it was like listed like all the different places that you can go in that moment. There was like some 24-hour places where you can get your medical card and like literally go to dispensary. But the internet and applications and companies have allowed us to, and telehealth really has allowed us to see how we can get that same health-based medicine that we need kind of at our fingertips. Shannon, can you talk a little bit about medical cannabis policy? Because I know that you spoke about it and somewhat of an expert.
There have been quite a few bills over the past few years, even prior to legalization, which took place under MRTA last year on March 31st. I just drew a complete blank. For one, there was a bill that has been proposed several times since 2017 that medical marijuana be covered by health insurance. And I'm going to read this straight from marijuanamoment.net, that on June 2nd, that just passed, New York Senate approves bill to mandate medical marijuana health insurance coverage. The New York State Senate approved a bill on Wednesday that would require public health insurance programs to cover medical marijuana expenses and clarify that private insurers are allowed to do the same. And they've been trying to push that bill since 2017. So I think that is incredible news for our program. And also there is another bill that was actually co-sponsored by my state senator coming out of Queens, because I'm a Queens native.
Well, I'm Queens, yo.
That would protect medical marijuana patients from eviction from their homes due to choosing to medicate with medical cannabis, because unfortunately one of the dirty truths about legalization movements is that you think that you get one part of this process done and you think everything else is just going to fall in line, and that's simply not what happens. And even though we do have a medical cannabis program, because of the way the racist possession laws are still set up, as a person of color, yes, I am still susceptible to arrest. And with these policies that Eric Adams is looking to bring back, and it's definitely a concern for medical patients of color.
Thanks, Shayna. Yeah, no, I think the policy, could you tell us what that resource is again? The resource?
I got this straight off of Marijuana Moment. They are a internet-based media company, from what I understand, and they cover a lot of cannabis news around the country. It's free. Their newsletter is free. You can simply go to their website and sign up. If you are interested in supporting their work, you can sign up for the membership with them on Patreon, and that will get, if you pledge about $25 or more, that will give you access to their bill tracker, and it tracks literally all of the cannabis bills in state and federal legislation around the country.
Awesome, thank you. Yeah, it's super important, and I think it's like when we talk about decriminalization and legalization, right? Like there are all these small aspects that are really not that small, right? So I'm sure many folks here can talk about their experiences if they did get stopped and frisked, right? And they were in jail, and they were, some prosecution was taken against them, and how that's impacted their lives. I know I have several friends whose parents, whose dads, it changed the trajectory of their life, right? They weren't able to get a job or certain jobs in certain areas, ended up having to look at low-wage work, several part-time jobs, having to do that work for their entire lives, and now being at retirement age, not having a retirement, right? Because they weren't able to get a job that had the full benefits because of their cannabis usage. And they use cannabis for many of the reasons that the panelists here have expressed, right? Some of them have used it, many of them have used it for, frankly, PTSD, right? And even though it's not been diagnosed, we all here, I'm sure, right? Everyone here on this full block who's out today can I'm sure, identify one moment in their lives that they're still, going through PTSD over, right? And it's not hard. All of us, no matter how little or how old, all of us have experienced some form of PTSD. Certainly being people of color in this country, you are in fact all working through the trauma of what it means to be a person of color in this country, where the country doesn't necessarily support you, right? I want you to be here. I think it's important, right? Cannabis is a plant. We have this beautiful plant again right here. But it's a part of our lives, right? We can't walk around and act like it doesn't exist. And so we have to talk about it. Everyone here, I'm sure, has their own cannabis story. Either that they've used it themselves, either that they've kept away from it. I know in my own experience, my dad was an avid user. My dad smoked cannabis all the time, and my mom always, stuck her nose up at him and said it was the worst thing ever. But as my father had lots of childhood trauma. When he was an immigrant, he immigrated here from Ecuador and unfortunately, found solace in alcohol, and so became an alcoholic. And towards the end of his life, when he was really, really sick, the only way that he was able to eat and feel okay was when he was using cannabis. He had lost all of his appetite because of his, end of life liver failure, right? And so he started to self-medicate. And then, went into the hospital, and that was a different story. But it's like people have different experiences of how they come to the plant, and more often than not, it's people use it for medicinal purposes. They just aren't doctors, right? No one has told them that this is officially your medicine, but folks do use it for anxiety. Folks do use it for PTSD, right? Going through everyday BS, right? Microaggressions that you experience walking down the street. All sorts of, sexual harassment that I'm sure plenty of folks who identify as women experience as they're walking on the street, right? Men who are just people, period, who grew up in, the Giuliani, New York, and Bloomberg, New York, with stop and frisk, who still, kind of seize up every time you see a cop or you hear alarms, right? And so these are moments that we have to just consider, and where cannabis fits in all of that for all of us. Do you have any resources, folks who are just interested, they want to learn more, they don't know where to go, they're afraid of cannabis? Do you have any comments that you would like to share with our group here?
The best resource I've ever had is PubMed, because it's government research and they can't fight their own shit. But if you have any questions like cannabis related, you can talk to me. You can ask me. I'm a walking resource.
It really
Scrog is a walking resource for cannabis. And I guess the only thing I would say, if you're scared, or if you're having any second thoughts, or you don't know what to do, it's just a plant. It's just a plant.
Go ahead, Shay.
As far as cannabis, as I previously shared, there's Marijuana Moment. A book that really has helped me as far as my medical patient journey has been the Cannabis Health Index. Please don't ask me the author off the top of my head. But the book is called the Cannabis Health Index. There is also the ABCs of Cannabis, I believe, by Shira Adler. And, goodness, I should have wrote this down before I came. But there is another book that was widely circulating. You can find it on Amazon, books, barnesandnoble.com, all your major literary retailers, and it's Women and Cannabis. So it actually specifically speaks to cannabis use for women and people who identify as feminine. As far as mental health resources, I did save a few. If you are in immediate crisis, this is the 24-hour crisis hotline for the Good Samaritans, 212-673-3000. NAMI NYC, which is the NYC chapter of the National Association of the Mentally Ill. Their hotline is open Monday through Friday, 10 a.m. to 6 p.m. Eastern at 212-684-3264. You can also text got 5 to 741-741. Now, for the fathers and the men specifically, there is therapyforblackmen.org. You can go on that website and find resources for providers, and it could even be free to sliding scale. So great resource, look them up. And then also lowcosttherapy.nyc. If you didn't catch what I said, don't be afraid. Feel free to come up to me and ask. One thing I do want to stress, mental health is not just a medication issue. Mental health is rent instability. Mental health is food instability. Mental health is ableism against disabled people. There are so many factors that can contribute to the decline or improvement of your mental health. And unfortunately, as people of color, we've been cut off from so much that is ancestrally ours to begin with. And something that I do want to point out, it being Juneteenth, is that medical racism was even used against us through mental illness. There was a Southern psychiatrist called Samuel Cartwright who literally created a mental illness to describe enslaved peoples who wanted to be free. Like that, can you imagine that? Being pathologized for wanting to be free? And yet that's a sentiment that continues to this day. So, as long as we educate ourselves and organize and really lean on each other, because that's how we got free. Let's be clear. Yes, Abraham Lincoln gave the Emancipation Proclamation in 1863, but it was really the enslaved Africans and their descendants who freed themselves.
This is a topic about mental health, right, and mental illness. There's no shame in mental health and mental illness, right? I think that's one of the if you don't take anything away from this panel, it's that mental illness, we have to stop the taboo around mental illness. Plenty of people and parents, since this is Father's Day, folks feel very, very hesitant to talk about mental illness. But I think from the pandemic on, we all knew that it was something that we all have to approach, right? We all have to recognize and collaboratively, collectively move forward and work together, right? There's a lot of trauma that has been brought up through this pandemic, but certainly trauma from centuries that many of us continue to pass down from generation to generation. Can I tell you a story? Once upon a time, the first time I ever used cannabis, I was 16 years old. It was a day before the last day of my senior year of high school. And I was super excited, and my friends bought the Ziploc bag full of marijuana. We went down the block to my house. We baked it into brownies. We took my dad's little roll paper, and we rolled it up into joints. We smoked a bunch of them, and I was high for about 36 hours straight. And it was literally the worst experience of my life in that moment, and I stayed away from cannabis because I was petrified, and with reason. When I tell people what I did, they're just like, oh my God, how were you? And I was so afraid, and I still had to go through my normal life that day, right? But for years, I thought that that's what cannabis usage was like, and it boggled my mind, why would you want to feel that way? I felt terrible. And it wasn't until, of course, I became older, I started talking to folks about it. I tried different things when I became open to it, and I had to figure out what my reason why I was doing it, right? My reason why I was interested in cannabis and what I liked, right? RSO for me was something that didn't feel as scary, and I felt like the dosing was much more accessible to me, and it wasn't scary anymore. Can we just do one thing before we end this panel? So we're all in community right now. Can we all take a minute, stop what you're doing? We're gonna take 3 collective breaths to unite us all, but also to tell our, our sympathetic nervous system that's probably going crazy right now, we wanted to stop it and bring our parasympathetic, right? The rest and digest part of our bodies, just kind of chill and tell ourselves that we don't have to be kind of all over, right? So all right, we're gonna do it all together. So we're gonna breathe in through our nose and then out through our mouth. Take a deep breath in through your nose and out through your mouth. Take a deep breath in through your nose and out through your mouth. And now take the deepest breath today and sigh it out. Thank you, everyone. Have an awesome day.